Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a continuation in a series of broadcasts we've been doing on whole person health and how to connect the idea of a whole person health approach to stress reduction and high blood pressure control. So today I'm focusing on the concept of family health. Earlier this week we've talked about physical health, emotional health, spiritual health, today family health. And the question today is, what does the role of the family in people having high blood pressure, and how can I help my family not have high blood pressure? Now, one of the common questions that I get as a doctor is the question of whether the tendency to have high blood pressure is inherited or not. And people who often have high blood pressure are wondering whether they got it from their parents and whether they're likely to give it to their children. And the answer is yes and no. The yes part is yes, there is a tendency to inherit the yes part is that we inherit a tendency to develop high blood pressure from our parents, but we do not generally inherit a certainty. We have a whole collection of genes that we will get from our parents that will either promote high blood pressure or not, but it's much more important to pay attention to the environmental issues that are going on. And these environmental issues are what decide which genes get turned on, and a whole lot of other things that are much more important than the family history. But what is important in terms of family health and high blood pressure is that the family is where children are taught how to live a life where they will not develop high blood pressure. So there are many keys that are part of a healthy lifestyle that include the physical, emotional, and spiritual things that I've been talking about. And the habits that children are exposed to in terms of how they eat, particularly the bad fats that are part of our diet, the high glycemic diet that many families have, all of this leads to a higher probability that those children will have high blood pressure later in life. Much, much, much more important than the history of high blood pressure in the family. It's whether the environment is turning those genes on or not. That's the main key to take away from this. So we're not victims of our genetics as much as we're victims of our lifestyle choices. So again, the model that I've been promoting is this whole person approach, body, mind, and spirit approach. And this is not only for you as I'm sharing this with you. This is for you to share with your family in some way. How do you share these concepts with your spouse, with your siblings, with your children? And how can you help them to live a life so that the diseases that are so common are much less likely to happen? The family is the best place to teach how to avoid these many diseases. So I encourage you to take advantage of your opportunity to be a leader in the family so that the family is a place of health of body, mind, and spirit, and that the probability of your children having bad diseases later in life are much diminished because of the good things that you've taught them about healthy life in body, mind, and spirit. So I wish you well in this. I encourage you to share this encouragement to be a source of health for the family with other people. And have a great day. God bless.